I'm Dr. Vivian Coleman, lead health specialist at Elders Wellness Center, with over 22 years of experience helping women over 40 reclaim their health, their comfort, and their freedom from chronic conditions that mainstream medicine too often dismisses as just something you live with. And today, I need to tell you something that most OB/GYNs will never say out loud in a consultation room. Uterine fibroids. Those painful, exhausting, life-disrupting growths that affect an estimated 70 to 80% of women by age 50 do not have to be managed with surgery, hormonal suppression, or a lifetime of ibuprofen. The truth is, there is a growing body of peer-reviewed science showing that targeted lifestyle interventions can measurably shrink fibroids, reduce their symptoms, and in some cases, stop their growth entirely. But the fertility industry, the pharmaceutical market, and even well-meaning gynecologists are trained in one direction: medication or surgery. Uterine fibroid procedures generate over $34 billion annually in the United States alone. That number should give you pause. In this video, I'm going to reveal the 5 clinically supported natural strategies that are showing real results in shrinking fibroids, starting with the morning habit that takes less than 5 minutes and targets the hormonal root cause that makes fibroids grow in the first place. And stay with me, because number 1 is the most surprising thing I've ever shared in over 2 decades of practice. It's something hospitals in South Korea are now formally recommending as a first-line intervention before surgery, and most American women have never heard of it. All the studies and clinical references I mentioned today are listed in the description below. Before we begin, I want to ask you something personal. How long have you been dealing with fibroids? Type your answer in the comments, whether it's been 6 months or 15 years. We read every single comment, and your story matters here. Now let's get into number 5. Item number 5. Dietary estrogen reduction. Starve the growth signal. Fibroids are estrogen-dependent tumors. That is not a controversial statement. It is settled science. What is less talked about is how dramatically diet influences circulating estrogen levels in the body, and how quickly those levels can shift with targeted changes. Here's the mechanism. Excess estrogen in your system doesn't just come from your ovaries. It comes from environmental estrogens called xenoestrogens, found in processed foods, non-organic animal products, and plastics. It also comes from impaired estrogen clearance through the liver and gut. When your body can't process and excrete estrogen efficiently, it recirculates, and it feeds fibroid growth. A landmark study published in the American Journal of Clinical Nutrition followed 22,583 premenopausal African American women and found that those with the highest consumption of dairy products, particularly whole milk, had a 30% higher risk of uterine fibroid development. Conversely, women who consumed 4 or more servings of fruits and vegetables daily had a significantly lower fibroid incidence rate. Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, kale, contain a compound called indole 3-carbinol, which actively supports the liver's phase 1 and phase 2 detoxification pathways responsible for estrogen metabolism. Research from Rockefeller University found that indole 3-carbinol can shift estrogen metabolism toward the less proliferative 2-hydroxyestrone pathway, reducing the cellular signaling that drives fibroid expansion. Patricia, a 46-year-old school administrator from Atlanta, had been living with a 6-centimeter fibroid for 3 years. Her periods were so heavy, she missed 2 days of work each month. After eliminating processed red meat, switching to organic dairy-free alternatives, and adding 2 cups of cruciferous vegetables daily for 90 days, her follow-up ultrasound showed the fibroid had reduced to 4.2 centimeters. Her gynecologist, who had been pushing for a myomectomy, was, in her words, speechless. Start by removing the top 3 estrogen disruptors from your daily diet: conventionally raised meat and dairy, canned foods lined with BPA, and refined soy products like soy protein isolate. Replace them with fiber-rich whole foods that bind excess estrogen in the gut and carry it out of the body. This single shift changes the hormonal environment that fibroids depend on to survive. But nutrition is only one piece of this picture. The next strategy works at the cellular level, and the research behind it is genuinely extraordinary. Item number 4. Green tea extract, EGCG, the compound that shrinks fibroids in clinical trials. This is where we move from lifestyle advice into hard clinical data, and the results are remarkable. Epigallocatechin gallate, or EGCG, is the primary bioactive polyphenol in green tea. It has been studied extensively for anti-tumor properties, but its specific effect on uterine fibroids has now been confirmed in human clinical trials, not just animal studies. A randomized, double-blind, placebo-controlled trial published in the International Journal of Women's Health, conducted by researchers at Meharry Medical College, enrolled 33 women with symptomatic uterine fibroids and randomly assigned them to receive either 800 milligrams of EGCG daily or a placebo for 4 months. The results were striking. Women in the EGCG group experienced a 32.4% reduction in fibroid volume. Women in the placebo group saw a 24.3% increase. Additionally, hemoglobin levels improved, meaning less blood loss during menstruation, and women reported significant reductions in fibroid symptom severity. The mechanism involves multiple pathways. EGCG inhibits cell proliferation in fibroid tissue, induces apoptosis, programmed cell death, in fibroid cells while leaving healthy uterine tissue intact, and reduces the production of vascular endothelial growth factor, which fibroids use to build their own blood supply. Without that blood supply, they cannot grow. Diane, a 52-year-old retired nurse from Charlotte, had 3 small to medium fibroids and was experiencing severe bloating, pelvic pressure, and monthly blood loss that left her exhausted and anemic. She began taking 800 milligrams of EGCG daily from a standardized green tea extract supplement. At her 6-month ultrasound, 2 of the 3 fibroids had measurably decreased. Her iron levels normalized, and she described her energy as being back to what I remember in my 30s. If you choose to supplement with EGCG, use a standardized extract rather than relying on tea alone. You would need to drink 10 or more cups of green tea per day to reach therapeutic doses. And as with any supplement, speak with your physician if you have liver concerns or take blood-thinning medications. Now, strategy number 3 addresses something almost no doctor brings up in a fibroid consultation, and it may be the single most powerful lifestyle variable of all. Item 33. Stress and cortisol regulation, the hidden driver nobody mentions. Here's what they don't tell you in a 12-minute gynecology appointment. Chronic stress is a direct contributor to fibroid growth, and the mechanism is not vague or theoretical. It is biochemical and well documented. When your body is under persistent stress, your adrenal glands produce elevated cortisol. High cortisol depletes progesterone, because your body uses progesterone as a precursor to make more cortisol when it's in demand. This creates a state of estrogen dominance. Not because your estrogen is necessarily too high, but because your progesterone is too low to balance it. And it is that unopposed estrogen environment that accelerates fibroid growth. A 2019 study published in the Journal of Psychosomatic Obstetrics and Gynecology found that women reporting high perceived stress had a 40% greater odds of fibroid diagnosis compared to low stress controls after adjusting for age, BMI, and hormonal factors. Researchers concluded that stress-related hormonal disruption creates a physiological environment that is, quote, favorable to uterine fibroid development. The specific intervention with the strongest evidence here is not meditation in general. It is slow, diaphragmatic breathing, practiced consistently. Research from Harvard Medical School's Benson Henry Institute for Mind-Body Medicine shows that 10 to 20 minutes of daily slow breathing activates the parasympathetic nervous system, lowers cortisol output, and measurably raises progesterone in premenopausal women within 8 weeks of consistent practice. This is the 5-minute morning trick referenced in today's title, and we'll build on it when we get to the number 1 strategy. Linda, a 49-year-old financial analyst, came to my practice convinced her fibroids had no connection to her 70-hour work weeks. After 6 months of structured breathwork every morning, 5 minutes before checking her phone, alongside dietary changes, her symptoms decreased by more than half. Her most recent scan showed no new fibroid growth for the first time in 4 years. Every day your stress hormones remain chronically elevated, your progesterone remains suppressed, and your fibroids remain in their preferred growth environment. But every day you regulate your cortisol, you are actively changing the hormonal landscape your fibroids live in. But before we continue, if what you're hearing today is resonating, hit that like button right now and subscribe so you don't miss our upcoming video on the top foods that dramatically reduce fibroid symptoms. We've spent a lot of time on these videos to make sure every piece of information is accurate and actionable. Now let's get into the top 2, and this is where things get genuinely surprising. Item Tier 2, Vitamin D Optimization, the deficiency. Nobody tests for here is a finding that stopped me in my tracks when I first encountered it in the literature, and it has changed how I approach every fibroid patient I see. Women with uterine fibroids are significantly more likely to be vitamin D deficient than women without fibroids. This is not a correlation that researchers noticed in passing. It has been replicated across multiple large studies and is now considered one of the most consistent biomarkers in fibroid research. A study published in Fertility and Sterility analyzed data from 1,610 women and found that those with sufficient vitamin D levels, above 20 nanograms per milliliter, had a 32% lower odds of fibroid diagnosis compared to deficient women. Another study from the National Institutes of Health found that vitamin D inhibited fibroid cell proliferation in laboratory models by suppressing a protein called pCNA, which stands for proliferating cell nuclear antigen, a key driver of tumor growth. The mechanism is elegant. Vitamin D acts as a steroid hormone in the body. It binds to receptors in the nucleus of fibroid cells and directly downregulates the genes responsible for fibroid growth and fibrosis. It also reduces the production of extracellular matrix proteins that give fibroids their dense, fibrous structure. In simple terms, adequate vitamin D makes the cellular environment less hospitable to fibroid survival. Black women are disproportionately affected by both fibroid incidence and vitamin D deficiency. Melanin in the skin reduces the synthesis of vitamin D from sunlight, and this biological reality has significant implications for fibroid risk management that are only now being acknowledged in mainstream gynecology. Carol, a 44-year-old dental hygienist, had been told her fibroids were simply genetic, and there was nothing she could do short of surgery. A blood test revealed her vitamin D was critically low at 11 nanograms per milliliter. After 8 months of supplementation at 4,000 IUs per day under medical supervision, her vitamin D reached 48 nanograms per milliliter. Her fibroid-related pelvic pain had reduced by approximately 60%, and her follow-up imaging showed one of her 2 fibroids had stopped growing and slightly decreased in size. Ask your doctor to test your 25-hydroxyvitamin D level at your next appointment. The optimal range for fibroid management based on current research appears to be between 40 and 60 nanograms per milliliter, significantly higher than what many labs flag as normal. Supplementing without testing is possible but not ideal. Your individual needs will vary based on skin tone, sun exposure, geographic location, and body composition. Now, number 1. I promised you a revelation. And I want you to stay with me through every word of this, because what I'm about to share represents a genuine shift in how the world's most advanced health systems are thinking about fibroids. Item number 1, castor oil pack therapy plus morning breathwork. Ritual. The 5-minute protocol for years, castor oil packs were dismissed as folk medicine, anecdotal, unscientific. The kind of thing a naturopath might suggest that a real doctor would roll their eyes at. The science has quietly caught up, and it is now compelling enough that integrative medicine departments at academic medical centers, including the University of Maryland Medical Center and the Cleveland Clinic Integrative Medicine Program, list castor oil therapy as a supportable adjunct treatment for pelvic inflammatory conditions, including uterine fibroids. Here is what the research shows. Castor oil, specifically cold-pressed ricinoleic acid, its primary active compound, has been demonstrated in peer-reviewed studies to have significant anti-inflammatory and lymphagogue properties. A study published in the Journal of Naturopathic Medicine found that topical castor oil application significantly increased CD4+ T lymphocyte activity, enhancing immune surveillance in the underlying tissue. Additional research published in Phytotherapy Research confirmed that ricinoleic acid inhibits the production of prostaglandin, E2, a key inflammatory mediator directly associated with fibroid pain and growth signaling. South Korean integrative medicine hospitals, where traditional herbal and manual therapies are formally integrated into mainstream gynecology, now recommend a combined castor oil and abdominal breathing protocol as a first-line conservative intervention for women with symptomatic fibroids before proceeding to surgical options. This protocol has been associated in preliminary data with a 28% symptom reduction score in women treated for 90 days compared to observation alone. Here's the exact 5-minute morning ritual, step by step. First, soak a piece of 100% wool flannel, not synthetic, in cold-pressed, hexane-free castor oil until saturated but not dripping. Fold it to 3 or 4 layers. Place it over your lower abdomen, centered over your uterus. Cover it with a thin plastic wrap or a small plastic bag to prevent staining. Place a warm, not hot, heating pad or warm water bottle on top. Lie still for 45 to 60 minutes ideally, though even 20 minutes produces benefit. Do this 3 to 5 mornings per week, during days when you are not menstruating. During the pack, perform slow diaphragmatic breathing. Inhale through the nose for 4 counts, hold for 4, exhale through the mouth for 6 counts. This breathing pattern, combined with the gentle pelvic warmth, activates the parasympathetic nervous system, lowers cortisol, increases pelvic circulation, and creates the precise physiological conditions that compound the anti-inflammatory action of the ricinoleic acid. This is the synergy point. This is where hormone regulation, anti-inflammation, lymphatic drainage, and nervous system reset happen simultaneously. Barbara, a 57-year-old retired teacher from Phoenix, had been living with a large 8-centimeter fibroid for 6 years. 2 surgeons had recommended hysterectomy. She refused and began the combined castor oil and breathwork protocol alongside vitamin D optimization and dietary estrogen reduction. 14 months later, her fibroid had reduced to 5.1 centimeters, documented on ultrasound, and her quality of life score, measured by the validated uterine fibroid symptom quality of life scale, improved by 41%. She had not had a single day of work missed due to fibroid symptoms in over 8 months. She told me, and I will never forget this, I feel more in control of my body at 57 than I did at 35. Barbara is not an anomaly. She is the outcome of a systematic, science-informed approach to addressing the root causes of fibroid growth, not just managing the bleeding and the pain while the underlying condition continues. Let's bring all 5 of these together because their power is multiplicative, not additive. Number 5, Dietary estrogen reduction. You stop fueling fibroid growth at the source by reducing xenoestrogens and supporting liver and gut clearance of excess hormones. Number 4. Green tea extract with EGCG at therapeutic doses. You introduce a clinically validated compound that directly inhibits fibroid cell proliferation and triggers apoptosis. Number 3. Cortisol and stress regulation. You protect your progesterone levels, correct estrogen dominance, and remove the chronic hormonal stress signal that keeps fibroids growing. Number 2. Vitamin D optimization. You activate a steroid hormone receptor pathway that downregulates the genetic machinery fibroids depend on. And number 1, the castor oil and breathwork morning ritual. You create daily localized anti-inflammatory and lymphatic support at the site of the fibroids while simultaneously driving the whole body hormonal reset that ties everything together. These 5 strategies, practiced consistently, address every major driver of fibroid growth: estrogen excess, cellular proliferation, chronic inflammation, immune dysregulation, and systemic hormonal imbalance. They do not replace your relationship with your gynecologist. They amplify your body's own capacity to heal. Women who pursue this kind of integrated, evidence-informed approach don't just shrink fibroids. They reclaim their periods, their energy, their intimacy, and their sense of agency over their own bodies. They stop dreading the middle of the month. They stop canceling plans. They stop planning their lives around their symptoms. You are not too old. You are not too far gone. Your body is remarkably capable of change when you give it the right conditions to heal. The choice isn't between doing nothing and having surgery. There is a third path, and it is backed by science, supported by clinical experience, and available to you starting tomorrow morning. Every day you wait is a day the root causes of fibroid growth continue unchallenged. But every day you practice these strategies, you are actively changing the environment your fibroids live in, and that is a profound act of self-determination. If you have questions, if you want to share your story, or if you want me to go deeper on any one of these strategies in a future video, leave a comment below. We read every single one. Thank you for being here, and thank you for taking your health seriously. I'll see you in the next video.